नमस्कार। इंडिया टॉप डॉक्टर में आप सभी का स्वागत है। आज हम बात करेंगे मेंस्ट्रुएशन और मेनोपॉज के बारे में। क्लासिक स्टडीज से पता चलता है कि मेंस्ट्रुएशन की विशेषताएं प्रजनन जीवन काल में बदलती है। जनसंख्या का मतलब मेंस्ट्रुएशन चक्र की लंबाई और परिवर्तनशीलता 20 से 40 वर्ष की उम्र के रूप में घटती है। इन वर्षों के बीच कई टैबू और मिथ है जो दुनिया भर में घूमते हैं। तो उन सभी मिथकों को तोड़ने के लिए आज हम डॉक्टर उषा एम करी के साथ बातचीत करेंगे। तो चलिए उनका स्वागत करते हैं। स्वागत है आपका इंडिया टॉप डॉक्टर में।
थैंक यू, नमस्ते।
नमस्ते। तो जैसे कि आप जानते हैं मेंस्ट्रुएशन और मेनोपॉज के बारे में बात करेंगे।
या डेफिनेटली।
लेकिन उससे पहले आप हमारे दर्शकों को अपने बारे में कुछ बताइए प्लीज।
आई एम डॉक्टर उषा एम कुमार। मैं मैक्स हॉस्पिटल साकेत में प्रिंसिपल कंसल्टेंट हूँ और 30 इयर्स का एक्सपीरियंस है। लास्ट 30 years से आई हैव बीन प्रैक्टिसिंग गायनी एंड I myself have super specialized in gynae endoscopy surgery. So I have done my MBBS and senior residency in 1992, and then I did my MRCUG from London, and then I did my diploma in advanced endoscopy surgery. So far I have done more than 10,000 of endoscopy surgeries successfully. So this is all about me.
That's very good to know, ma'am. Congratulations on your success till now. So as you know, we have studied how the period span or anything related to period, the experience regarding that is different from one woman to other. Why is that?
You know, each and everybody is different. It's like we all have a human body, but the hormone levels are different and the body structure is different. The same way, the hormonal cycle, because menstruation depends on the hormonal cycle. Basically, all women, we have one uterus, two ovaries, and two fallopian tubes. So ovaries are the center of hormone production. So basically, it depends on how much amount of the hormone or the estrogen, progesterone is coming from ovary. So the menstruation cycle is different for everybody. Some women are having short cycle, like 28 days of cycle. Some women are having 31 days of cycle. Some women are having only 3 days of period. Some women are having 7 days period. So norm for each and every woman is altogether different. So the person who's having single day period is also normal, because many times these women, they are asking me, doctor, earlier when I was like 25 years, I was having cycle for menstrual bleeding for 5 to 6 days, but nowadays I am having only single days bleeding. So as long as your period is coming on time, as long as your period is lasting at least for 1 day, 1 to 3 days, or 1 to 5 days, that's all normal. And as long as the period pain, that's very important thing. Some women, they are having they have simple little bit of pain, they don't need to take any medication. But sometimes the women, they are having terrible pain and it's not even going away with medication. So if you happen to have pain, like if you are supposed to take only a single dose of some painkiller or 2 days of painkiller, that's it, this is normal. But the period pain which is outlasting the periods, or you have to take injections during your periods to kill the pain, that's not normal. So it's different for everybody. And if they have problems like this, definitely we'll be discussing later on in the talk. So if they have period problems like pain during period, too much pain during period, too much bleeding during period, too much bleeding, we have to find out whether they, some women, they say their period is lasting for 10 days. So that's not normal. 1 to 5 days cycle is normal. But if it is more than 5 days, more than 6 days, and they are using more than 3 pads a day, that's also not normal. So some women, they are using 4 to 5 pads in a day, in the initial days of cycle. So 1 to 2 days earlier, the first 2 days, that's normal. But throughout the period, if they are using 5 to 7 pads, still they are not, still they have too much of bleeding, and the duration of the bleeding is also too long, that's not normal.
All right, that's pretty much we will talk later on, I guess. My next
Yeah.
question is that we have observed or seen like during periods, many people poop a lot than regularly, you know. Why is that? Can you tell us?
The problem is the organs, like the uterus is sitting lower down the lowermost part of the tummy, and that is the place where your food pipe is also there. So, and as I told you, the menstrual cycle is all related with the hormones, and some hormones, the trigger hormones, are coming from the brain as well. So if the brain is getting triggered and it's giving signals to ovaries to secrete hormone, and then ovarian hormones are coming in the body, and these estrogen and progesterone are giving signals to the uterus to have bleeding or to menstruate. So these hormones basically they are acting on one organ, but in some women they are acting on other organs as well, like they are acting on the food pipe. So they are acting on your bladder, and the overall the body becomes very sensitive. So that could be the reason. It's not very common, I have seen, but some women, yes, they do complain about it. So this can happen in the first 2 days of cycle.
All right. So I'm gonna drop a bomb on you. That is PMS. We have heard this word a lot, but we don't talk about it much. So can you tell us, is it real? And what is PMS? Actually, what it
Okay.
is?
Yeah, so this is basically acronym for premenstrual syndrome. Now, what is premenstrual syndrome? Pre is before, and menstrual is your period. Syndrome is some complex complaints. There are so many things the patient they are usually complaining. So premenstrual syndrome, what these women they say, this is something is quite common, very common. Like if you talk to the 10 women, 8 out of 10 they will tell you they are having premenstrual syndrome. But definitely the severity or gravity of the situation is different for the different person. Some women they are just having mood swings before the periods, especially in the older age group of the women. Some women they have bloating all over the body, so they
Right.
think they are gaining weight, and there is they think they are getting fatter during just before the periods, just 5 or 10 days before the period they are gaining weight all over the body. It's sort of swollen face, swollen body sort of thing. So they say I'm feeling bloated up. Mood swings, as I said, it's very common. Sometimes they have the craving for some things, like some women they want to eat a lot of sweets these days. Some women they want to eat something fried materials and all. So the premenstrual syndrome is very complex situation, and if it is little bit like in the mild, we say we can, if we can grade the situation. So if it is in the grade 1, they're having little bit of the changes in their body, little bit of the changes in their mind, emotional changes and all. So then it's fine. But when they are young, these changes are less, and they feel so jittery. They feel they want to fight with somebody. So all these things, they are little less when they are young. But as the body, as the age goes on and they are crossing 40 years, the happy hormones in the body are getting lesser and lesser. So happy hormones are estrogen in the body, which is ovaries, which is coming from the ovary. So if this hormone is getting little lesser in the old age group, ovaries they stop making eggs. It depends on the hormone amount of the hormone secretion, depends on the ovarian activity, how much hormone ovaries are giving to us, and how many eggs our ovaries are making in the body. So when this hormone becomes lesser in the body after the age of 40 or 45, then this premenstrual syndrome is becoming horrible, and they really need support. So in the young girls, we say just to allay down the anxiety, just to dismay all these symptoms, to listen music, talk to your friends, take this a little bit of painkiller which is suiting to you. But in the older age group, when we are sure this is because of the hormone deficiency, in such women we tell them to go on hormone support, and we do give It's not necessary exactly to go on hormone support, because no one would like to take the hormones in the older age group women. There something natural substances in with we are having in the kitchen, like soya bean, which is a very good. They have got phytoestrogen. Phytoestrogen, they are not exactly estrogen hormone, but basically they act like estrogen. So soya bean is one, and we ask them to eat a little bit of soya bean. They should include soya bean in their diet, and we can put them on the substances, on the supplement which have got soya bean into it. So it acts as a phytoestrogen, and they can get relieved with the premenstrual syndrome.
All right. Now, I would actually like to cover a very less talked about disease through you, of course. What is PCOD and how one can cure from it?
Yeah, PCOD is something is very rampant. Believe or not believe, if I'm seeing like 10 patients in OPD, and if they are younger age group like 30 to 40 or 20 to 40 rather, so they 8 out of them, they are having PCOD. So PCOD is sometimes the women, they are really getting scared, and they go for the health checkup, or they get the ultrasound done, and there is a PCOD picture in the ovary. What is PCOD? PCOD is polycystic ovarian syndrome, so, or disease. So basically what happens in any woman's life, ovaries, they are making single egg in a month. So in PCOD, we call it polycystic. Polycystic means they are, poly means many. So actually these are not cysts, they are the eggs, and there are so many eggs, they start forming in the ovaries, and because so many eggs, they start growing all together, there is no space for one single egg to grow to the age of maturity. That means until unless one single egg will not grow up to the size of 18 millimeter, we don't call it mature. So these are all very small eggs, like 2 millimeter, 3 millimeter, and the whole ovary is studded with all these small eggs. So in the bargain, what happens when the ovary is full of these small eggs, and there is none of the egg is getting mature, none of the egg is getting in good size. So in this situation, what happens? Ovaries stop making very good egg, and to conceive for every woman, there should be single egg of 18 millimeter size at least. So if the ovaries are not making egg, we call it anovulatory cycles. The menstrual, she is menstruating every month, but the cycles are, during the cycles, she is not making eggs. So they find it very difficult to conceive. This is one scenario, but the most of the time, the unmarried girls are coming, and they complain of, doctor, I have been diagnosed with PCOD and gaining weight, my periods are not regular, my periods are delayed. It's earlier I used to have cycle like every 28 days or 30 days, but nowadays for 2 months, 3 months, I'm not having periods. So the cycles are delayed, and they're gaining weight. There is extra hair on the face, all over the body, on the chin, on the breast, and on the tummy, and they have got truncal obesity. Truncal obesity is because what happens in PCOD? So estrogen is basically female hormone. Testosterone is basically male hormones. So when ovaries are not making one single good egg, they stop secreting estrogen, and there is the dominance of the male hormones is becoming more over the female hormones, and this is the reason the body start getting extra hair. This is the reason we have got truncal obesity, and the tummy is becoming bigger than the other females. So this sort of scenario starts coming, and they start having hair fall. There's so many things. So they start complaining that this is all coming to me, I'm feeling lethargic, there is extra pigmentation on my body. So these are the symptoms of PCOD. So if they come to me, the treatment is altogether different. If somebody is young enough, and the main problem is that the patient is gaining weight, and there is extra hair on the body, we put them on insulin sensitizer, because basically insulin is the hormone which is controlling blood sugar in the body, and the body becomes, in PCOD, becomes resistant. Resistant means, so body is not responding at all to the insulin. So this is the reason you are gaining weight. This is the reason you have high blood sugar in your body. So we put them on insulin sensitizer, we put them on the medication which help to lose weight and which ask them to take measured diet, talk to the dietitian, put yourself on some dietary supplements or high protein diet and do regular exercises. Exercises are very, very important, you know. So whole idea is to lose weight. So if they are losing at least 5 kg of the weight, that helps the hormones to come back within normal limits. And this treatment is basically for the young girls. But for the women who are married and they are finding difficult to conceive, as I told you, these are supposed to make single good egg, and they are not able to make single good egg. In such situation, we put them on ovulation induction drugs, some tablet to help ovaries to make single good egg. So most of the 80% of the women, they are getting, they are happy and they are getting pregnant within 3 to 6 months of span of time. But some percentage of the women, like 10% of the women, whatever you give them medication, whatever they reduce the weight, still their ovaries are quite resistant. They are not making single egg. In such situation, we advise them a single treatment that we call it laparoscopic ovarian drilling. So this is basically surgery. This is only for the women who are not responding with the medication. So we ask them to get admitted that single overnight they are supposed to stay in the hospital. And laparoscopy surgery, if you have heard about it, this we call it minimum invasive surgery or keyhole surgery also. So earlier, if you remember, earlier when any time if we have to do any surgery on the body, we have to used to make big cut, like 6 to 7 centimeter of the cut to go inside the tummy and to see the organ. But nowadays technology is very much advanced, and as I told you, I have myself super specialized into endoscopy surgery. We just give 0.5 centimeter of the cut. You know, if you see this finger, this is basically 1 centimeter of the width. So half of the width of this finger, we have to give cut 0.5 centimeter of the cut. What we do with that, we just go to the ovary and we destroy or we take away the bad eggs basically, which are occupying the ovary and not letting the normal egg to grow. So we just destroy them, we just take it out, and we we create the space for normal egg to grow. So this procedure is very simple. It hardly takes 5 to 10 minutes. It's a minor procedure. Only thing, she has to stay. Sometimes we can discharge the patient in the evening, or sometimes they just need to stay overnight over there. And good thing is, when we do such procedures, we get the opportunity to check the tubes, because sometimes we are thinking the lady is not getting pregnant because the ovaries are not responding, she has got PCOD, and there is some other factor. So any woman to conceive, basically we need a good uterus, we need patent, that means the fallopian tube should be working, and we need good sperm. So ovarian drilling helps ovaries to make good eggs, but at the same time you put the dye in the tubes and we check whether the tubes are opened up or not. So we can check inside the uterus also. Sometimes there is inside the uterus there is a cavity where baby stays. So this cavity is normal or not, that also we can check. We call this procedure hysteroscopy. So these are the tiny scopes. We can put it inside the cavity, and there is hardly, hysteroscopy doesn't even need any cut. We just go through the natural orifice and we see inside the uterine cavity. So any obstructing lesion, any growth, any septum, anything, we can see and we can treat at the same time. So I call it see and treat approach. So the patients who are having, just to summarize, the patient who are having PCOD, we put them on the diet control, we put them on the weight reduction journey, ask them to do a little bit of exercise. If it's not working, then we put them on the insulin sensitizer or the treatment medication to ovaries to get help to ovaries to make good eggs. If this is also not working, the last resort is laparoscopy and hysteroscopy. We always help them with these minor procedures. And trust me, 60 to 80% of the women, they do conceive within 6 months of the surgery.
Thank you actually so much for those really, it was really informative, and I am sure people now are more aware of that topic. Ma'am, there are few myths going on in the world, and we would like you to clear those. Number one is periods, during periods, can a woman get pregnant?
This is also one of the things where sometimes the women, they come to me, the urine pregnancy test is positive, and they tell Dr. Usha, I had period last time. How is it possible? So, what happens, like the person who's having menstruation for 3 or 4 days, that person is having, if the person is not skipping the period but having scanty period, so the person is having only single day of bleed or just a spotting is coming. So what happens basically when they conceive, the moment the baby comes inside the uterus, baby tries to get attached to the inner cavity or inner lining of the uterus. So in this process, when the baby is trying to get attached to the inner lining of the uterus, there is a little bleed. We call it placental implantation bleed. So basically the connecting link of the mother and the baby is forming. And because of that, there is little bit of bleeding. So important thing is these women, they are not having the proper menstrual cycle, but they have very scanty cycle. They, as I told you, in place of 3 to 5 days of the cycle, they are just having single day bleeding. So this scanty bleeding can happen even if they are pregnant. So this is the reason why the bleeding happens and still they are pregnant.
And is it true that the irregular flow of during periods, women get, they get different kinds of diseases during irregular flow? Is it a sign of that? Is it true?
Irregular period, basically, as I told you, basically your cycle is being controlled with hormones. So if the hormones in your body is not normal, then your periods are also not going to be normal. Periods will go haywire. So this is the first sign to tell you that there is some imbalance in the hormone. Or sometimes in the ovary, there are the tumors, there are the cysts, which these ovaries, ovarian tumor, they are also giving extra hormone to your body. And because of those extra hormone, uterus starts bleeding and the patient, they start having irregular period. So this is the sign that something is really going wrong with your hormones, and they should be keeping check on that. They must consult gynecologist. So check the hormones, check the uterus, do ultrasound. That's very, very important, just to pinpoint the reason why this is happening. Irregular periods, if this is happening in the 45 plus or 50 plus women, then this is because of perimenopausal stage. For every woman, the period starts at the age of 10 to 14 years of age. We call it menarche. So the moment you turn 45 or 50, ovaries stop slowly, they stop working. So you are still having period, but you are having irregular period because hormones are not in your body. Basically, the hormones are not in good enough amount to give you regular periods. So irregular periods, if you are facing at the age of 40 to 45 or 40 to 50 years of age, that is the sign that after some time you are going to have menopause. So we call it perimenopausal period. So nothing to worry about it, but at the same time, I would suggest you not to ignore. You should consult your gynecologist because we have to be very sure why this is happening. If we have to rule out all other reasons, we have to do hormone check, we have to do ultrasound, we have to do examination, internal examination. So once we are very sure that nothing else is wrong, it's just because of the hormonal imbalance, which is normal, which is very physiological, which happens to all women at the age of 40, 45. So then it's fine, then nothing to worry about it. But if the irregular periods are happening in the young age group, like 20 to 40 or 45 years of age group, one should take notice of that again to go for examination because we have to rule out the diseases. That's important.
Talking about menopause, can you tell our audience some of the symptoms of menopause?
Yeah. So menopause is basically when you are your periods are slowly vanishing or vanished, like you are no more having periods for last 2 years. We call that lady has got menopause. So what happens in the menopause? Basically, the problem is, when we are young, as I told you, there are two hormones in the body which are coming from the ovary. That's estrogen and progesterone, and these hormones, they're very important hormones. They are keeping us young. They help ovary to make eggs, and they are keeping everything healthy. They are keeping your skin shining. They are keeping your bones very healthy. Your hair look beautiful. It's all because of estrogen and progesterone. So as you are approaching toward menopause, these hormones are slowly dropping down in your body, and this is the reason uh, everything like everything is on the little higher risk of like bones are getting brittle, your body weight is also, you are gaining weight, and the skin is also getting wrinkled and all. So during menopause, there basically one should pay attention to two three things. Number one, the bone health is very very important. That's number one. Number two is, and during menopause or post menopause, if somebody is having bleeding, like for the 2 years you never had bleeding, you never had your periods, but after 2 years if you start having bleeding again, so that's worrisome. Don't think your period has come back, you are again start feeling younger and then fine, it's okay, so it's like the normal menstrual bleed. It's not, basically. So the best idea is to check with your gynecologist, and she will advise you to go for ultrasound. Why ultrasound? We have to check the inner lining of the uterus, because usually once the menopause happens, the inner lining of the uterus becomes very thin, 4 to 5 millimeter or up to 8 millimeter. That's normal. But if it is more than 8 millimeter, it's more than 10 millimeter, that we have to rule out the possibility of endometrial cancer, which is basically, this cancer is very rampant in the foreign countries, but this is nowadays I'm seeing in the Indian women also. This is also, I mean, there are so many women, they are coming with biopsy report of the uterine endometrial cancer. So one has to keep the check. If the postmenopausal bleeding is happening, that they should not ignore it, number one. Number two, there is one simple test. We call it pap smear. I think most of the women, they are listening to this talk, they have heard about it. What is pap smear? Basically, we take the cells from the mouth of the uterus and we send it for detailed examination under microscope. So this test is a very simple test. This is non-invasive, non-painful test. This is the same test, same way we can do as we do the internal examination. And trust me, there is no pain. So we can take, and this test is mandatory for all women, whoever is sexually active, even after the age of 20, 25, till the age of 60, one should be doing it regularly, every 3 yearly, 2 yearly, to check whether the cells on the mouth of the uterus is normal or not. As I told you, postmenopausal bleeding could be because of endometrial cancer. So the mouth of the uterus we call cervix, and the cervical cancer is number one killer in India. How we can detect cervical cancer? Cervical cancer, brittle, bones become weak, and if you are not in habit of taking dairy product, or there is a possibility that the bones really becomes weak. So one should be doing DEXA scan to check the bone health. That's also very, very important.
All right. So you stated few issues regarding menopause. Can you tell us how one can prevent it?
So the first step to prevent such problems is your awareness. One should be aware that these are the organs in the body. We all know the uterus is there, but we do not know the mouth of the uterus, cervix, as I told you, and ovaries are there. But we should be also knowing these organs can get affected with the cancer. There is a risk of uterine cancer in the menopause. There is a risk of cervical cancer. There is a risk of ovarian cancer. So how we can prevent all these things? They are the screening test. Unfortunately, for the ovarian tumor, there is not such test to find out, like pap smear I told you for the cervical cancer, endometrial biopsy I told you for the uterine cancer. For the ovarian cancer, we cannot take biopsy. We cannot take the cells from the ovary because these are hidden organs. So the best screening test for the ovarian tumor is ultrasound. So if in ultrasound there is a finding that there is ovarian tumor which is suspicious of malignancy, 80% of the time the ovarian tumor are not cancerous tumor, they are the simple tumor. So if any woman, she is finding tumor in the ovary and they are getting panicked that could be ovarian cancer, no, 80%, 80 to 90% of the time these tumors are not cancerous. And these tumors are like simple cyst filled with water. Sometimes the cysts are filled up with the blood, we call it chocolate cyst. So basically the disease we call endometriosis, which is also not cancer. So 10% of the tumor that could be cancerous. And then there are the certain tumor markers, there are the certain blood tests to do just to find out the tumor which is there in the ovary is basically non-cancerous or cancerous. So they are the tumor markers. We have to do some advanced tests like CT scan, MRI, just to find out. But basically these MRI, CT scan, and tumor markers, they are all suggestive tests. They will tell you there is a possibility. So if they tell you that there is a 80% possibility that tumor is non-cancerous, or they can tell you, but 80% is a possibility that could be cancer. So these tests are just suggestive. The confirmatory test is histopathological examination. Histopathological means the biopsy, when we take out the tumor mass and we send it for examination. So then that is the only confirmatory test. So if these things are happening in the body and we have to plan surgery, then there is a test, we call it frozen section, which is recently come up. And this frozen section is very important test we can do at the time of surgery. So I just want to tell you a little bit about the frozen section, what we do. Like for an example, I am operating any 40 years old woman. She has got tumor in her ovary, and the CT scan or ultrasound has been done. According to this ultrasound, CT scan, they are not sure. This is inconclusive. They say it could be cancer, it could not be cancer. So then we plan to go ahead with the frozen section. What we do, we take the biopsy from the ovarian tumor at the time of surgery, and we send it for histopathological examination. The beauty of this test is within half an hour, we get the report of frozen section. So, and it is 70% accurate. This test tells us whether the tumor you are going to operate is cancerous or not cancerous. Good point is that we come to know the result at the time of doing surgery. So we can plan the procedure. So for the cancer, I'm sure all of you must be having idea. For the cancer, we have to plan little extensive surgery. There are the nodes we call lymph node or gathe, which are around the tumor. And we know the cancer cells first go to these tumor cells or lymph nodes. So what we can plan during surgery, we can remove the tumor, we can remove these lymph nodes also. Then your body is completely free of cancer. So that's very, very important. That is the advantage of having frozen section. This frozen section is not only helps us in to find out whether it's cancer or not cancerous in ovarian tumor, but this frozen section we can do when we do the surgery for uterine cancer, for cervical cancer, for any sort of cancer. Nowadays we perform the frozen section. So the whole idea is to find out the possibility of the cancer at the time of surgery. In one go, the complete surgery can be performed. So patient need not to wait for another 10 days. If we don't do the frozen section, we remove the uterus, we send it for examination, and the report comes after 10 days. So if that 10 days after report tells us that this is the tumor we were dealing, that tumor is cancerous, then we have to tell patient that she has to undergo another surgery, I think, which is a crime. So to save the patient from the second surgery, the frozen section is a wonderful idea. So screening tests are very, very important to protect. I would suggest all of the women, if they are 40 plus, they should go for proper health checkup every 2 yearly. And being gynecologist, the basic health checkup is pap smear and transvaginal sonography or ultrasound whole abdomen and DEXA scan, just to check the health of mouth of the uterus, to check the uterus and fallopian tubes and ovaries. So these are the screening tests which we do in the health checkup, normal health checkup every 2 yearly. Mammography, don't forget, that's also very important because breast cancer is also is quite rising. So if the woman is less than 40 years, we advise them to go for ultrasound examination. But if it is more than 40 years, we tell them to go for mammography. And with mammography and ultrasound, we can actually detect the lump. There is something we call the self-examination of breast as well. So that is the 4-quadrant test. All women, we can do it with their own hands, and they can feel if there is any lump or any mass in the breast. If they are suspicious of any lump or mass, or if they have family history of breast cancer, they should again check to the gynecologist, and they should be doing ultrasound or mammography depending according to their age group. And they should be involving this also as a screening test to protect against the cancer of the breast.
Okay, it was really an informative session, ma'am. I wouldn't take much time of yours. Just one last question. Any message you would like to share with our audience?
Yeah, that's your body gives you signals. Your body body always keeps telling you that I'm not well. So if for an example, you are having fever for single day, and the fever, you feel maybe you are having cough and cold, or you are very tired, so that your body temperature is high, you take paracetamol and you become okay, then it's fine. But if something is coming again and again, it's bothering you again and again, like any body pain, tummy ache, menstrual irregularity, anything which is coming back again and again, please do not ignore. You have to consult your gynecologist, you have to consult your physician to find out, and please do not ignore the test they advise. Sometimes we think this doctor unnecessarily telling us to go for pap smear, unnecessarily telling us to go for ultrasound. No, that's not true, because I don't think anybody can advise you extra or unnecessary test. Basically, we do advise the test if we think really it is required. And the whole idea is to catch disease in its early stage. That's the most important thing. Because any problem, which is any disease, if we are able to catch in early stage, that it's completely curable. It's completely treatable. But if, I have, being gynecologist, I have seen the women they're coming to me, doctor, I had fibroid. This was 5 centimeter big. Since ages, last 10 years, I'm having this fibroid, and now I started having little bit bleeding and this. And, don't ignore that. Don't harbor the disease in your body. So even if you have coincidental finding of fibroid, which is not bothering you, still please consult to the doctor, consult your gynecologist. If we catch these problems in early stage, we can treat you with medication. The surgery will not be required. Or if surgery is required, like for early cancer, early uterine cancer, early cervical cancer, it's completely curable. We can completely get rid of the disease. If the cancer has been detected with very early stage, it's there in the inside of the uterine cavity only. It's not spreaded in the another wall of the uterus. We can completely remove it from your body, and you can live life absolutely like normal. You can just forget about any time you had cancer of the uterus. But if you ignore these signals, and then disease is getting advanced, then being doctor, being clinician, our hands are tied up. We have to tell you, if this is disease, then we have to operate. Fibroid is big size, chocolate cyst is of big size, we have to operate. There is no other option. For cancer, if it is advanced, We can't do surgery. We have to tell you that you have to go for chemotherapy, radiotherapy. So please do not ignore any signals, any abnormal signals in your body, which is body is giving to you again and again. Once or twice happened, you have taken some medication, self-medication you have done at home, fine. But it's coming back again and again, and you are ignoring it over the months or years. That's sin. Don't do that. So that's my message. And second thing, don't ignore your health. You have to find out some plan for you, schedule your diet, schedule your exercises. You have to involve some sort of exercises in your routine time. Many women, when I tell them to do exercises, they tell me, doctor, 7 o'clock I have to get up and then have to get ready, I have to cook food, I have to get ready for the office, and coming back at the 8 o'clock, there's hardly any time. Do yoga, please do breathing exercises wherever, whenever. If you can do it, even if you are working in the office for long duration, sit on the chair, close your eyes, do a little bit of breathing exercises. If you can walk in a day, that's wonderful. If you can join the gym, that's excellent. So please involve some sort of exercises in your daily routine, and please mind what you are eating. That's very, very important, because that is not for other people, that is for you yourself. Your skin will shine, your hair will shine, if you are really taking good diet which is rich in antioxidant, like nuts, like fruits and green vegetables. So diet plan is important. Your daily scheduling of exercise is also very important, and the most important is healthy mind. So be very happy, do things whatever you feel like doing it, don't compromise. That's my message of the day.
Absolutely well said, ma'am. Thank you so much for joining us. It was really great talking to you.
It was wonderful to talk to you, dear. And I'm sure, or I really hope, my viewers or listeners, they can get some information from this talk, and they will be
Thank you so much, ma'am. And if you guys want to book an appointment of Dr. Usha, you can do the same by visiting India Top Doctor.